We start today by talking about an important topic, joint replacement. And of course, the surgery in joint replacement has become better than ever, thanks to this man moving to the community. I want you to meet Dr. Peter Ramsey. He is with Coastal Orthopedic Associates, affiliated with Conway Medical Center. And I understand, first of all, that the school you went to is like one of the best in the world in joint replacement.
Well, I don't know if it's one of the best in the world, but it's definitely known throughout the world. It's a place called the Anderson Clinic, and it's just outside of Washington, D.C. in Alexandria, Virginia. And they've been doing over 1,500, and last year I think we did 1,800 hip and knee replacements last year between the 5 surgeons. And there's always 3 or 4 fellows every year that learn for 1 year, training just with them to do just that.
Peter, while you were going through medical school, did you always know that you wanted to specialize in joint replacement?
You know, I didn't. I always thought maybe growing up that I'd want to do orthopedics because I'd injure myself playing sports and things like that. But once I got into medical school and through my residency and all my orthopedic training, it became clear to me that that was the thing that I enjoyed the most. And I think the thing about joint replacement, hip and knee replacement, that I enjoy the most about it is that you see a patient who has been struggling for years with arthritis and pain in their hip or their knee. It's really changed the way that they live. They've given up things that they like to do, and they finally come to the point where they have to do something about that. And when they get to that point, and I can help them with a hip or a knee replacement, it really changes their life pretty quickly and dramatically. And it's really satisfying.
Let's talk about the new wing at Conway Medical Center, because I understand this is like first class.
Mm-hmm. Yeah, I was very impressed coming here to this community to have a facility like that at our hospital at Conway. In DC, I trained at a number of hospitals, including some additions, and I would honestly say that this wing stacks up right with them. There's big rooms that are very nice and clean, private bathrooms and everything. It's just a very nice facility for patients to be and for families that want to visit as well.
But it also must mean a lot to someone having a joint replaced that they're in an area where the nurses also specialize in this treatment.
Yeah, not only is it facility related in terms of larger doorways and things that can accommodate a patient that is using a walker as they recover, but it is dedicated nurses that stick with the patients every day and nurses that know what to expect and anticipate what's normal, what's not normal after a hip or a knee replacement, who can quickly make an assessment and contact me or one of my partners if necessary.
You've brought the hip replacement parts, so let's talk a little bit about that and show us what actually happens.
So in a normal hip, this would all be bone, and the yellow part is the bone. This would be the pelvis side, or the socket in the joint, and this is the femur side, or the ball, which is the ball in the socket. And what you see is a hip replacement after it's been done here. What we typically would do is take the ball and the socket apart and replace the ball with a new metal ball, or in some cases ceramic or other materials, with a component such as this. Once we put this together, we insert that into the bone that we've prepared, do the same thing on the socket side with a new cup, and then we put them back together in the patient, close everything up, and we're done.
You make it so easy. I mean, that was just amazing. But the fact is, these parts are better than ever. And I guess when people had joint replacement, especially hip replacement in years gone by, they were so worried that the parts were going to wear out fast. Things like that are better than ever.
They are better than ever. We know that joints that were replaced 15, 20, 25 years ago lasted reliably 15 to 20 years without wearing out. Now there can be any number of other problems that can happen with them, but in general, in a well-functioning hip or a knee replacement, 15 to 20 years is easy to expect based on what we put in then. Now we have harder plastics, all metal hips, all ceramic hips, and all types of variations that may be better or not as good for each individual patient. But new surfaces are exciting to us in that it's hard to imagine a metal ball bearing wearing down over a patient's lifetime even in 30 years. But we just don't have that data yet because it's been around for 10 years. So our gold standard is better than it was, and what we have now may even be better than that.
Let's talk about the knee.
This is a typical knee replacement model, and again, the white part is the patient's bone. Instead of actually cutting off above and below the knee and replacing the whole knee like we would normally do, or like some people would imagine potentially, what we actually do is reshape the ends of the bones. So we're maintaining the bone in its structure. We're just replacing the cartilage part in here, and we put a new cap on the end of the femur bone, and we put a new cap on the top of the tibia bone with a hard plastic piece in between. We keep the ligaments on the outside, and in some cases a ligament or two in the middle. And that's how a typical knee replacement is done. And again, we close right over the top, and that's it. So they are big procedures to have a hip or a knee replacement, but in general the recovery is faster than it has been even then as well.
It's break time, Peter, but I want our viewers to know that when we return, we're going to talk about when you know enough is enough, when to say enough with the pain, I'm ready for the replacement. Peter's going to address that and a whole lot more. Do stay with us.